Good evening, everyone, and welcome to this another episode of Wednesday Musings with Dr. Professor Borate sir. And today we are going to talk about a very important issue with which we face not only from our residency but even in our senior years on work-life balance in orthopedic practice. So, for further proceedings, I'll invite Taran, our convener, to take over. Over to you, Taran.
Yeah. Thank you, Ashok Sham, sir. Welcome, Dr. Borate, sir.
Yes, good evening.
Yeah, good evening, sir. So, at the start, I would just like to mention that apart from the numerous videos and talks on the academics, which OrthoTV has been providing for us since so many years, this is a very nice approach. The Wednesday Musings is a very nice approach to give a very holistic teachings towards being an orthopedic surgeon and not just focusing on academic aspects, because we have been covering how to be a good resident, good orthopedician. Last talk we discussed about financial management as well. So today our topic is work-life balance in orthopedics. So what is the first about the work-life balance? It is obviously necessary in all aspects of in all professions, but it is so much important in a doctor for a doctor, especially in our country where in a current world we are living in. It is such a hostile world, especially in emergency fields like orthopedics. So there are some aspects which are out of control. You can't control everything, but there are certain aspects which you definitely can control and manage your work and life, your personal life accordingly. So this is what is work-life balance, and this is what we are going to discuss about today. So over to you, Borate sir, to start with work-related issues, I suppose.
Yes.
What do the problems orthopedicians face?
Yeah, the interesting thing is that today I am going to look at this whole subject in a completely different manner. Because, when somebody opts to become an orthopedic surgeon and he undergoes training and he passes the exam and he is embarks on practice, there are many things that we are completely unaware when we go into the professional practice. The first thing is that we are expected to have good professional knowledge and competence. That we understand, and that we are usually confident once we have passed the exam that yeah, I can handle any patient with any problems and I can take care of him. I'm competent to handle and I know what to do in case there is something. I'm okay with this. Second issue is what is known as professionalism. Now, what is professionalism? Professionalism is the ability to function uh, at the best of your ability in spite of any problems in your own life, in spite of any difficulties in your environment or in your workplace, in spite of all that. I mean, you may have a nurse who helps you who is absent that day. You may have had a big fight with somebody just some time back. You may be going through certain issues with your family or with your children. But professionalism means to be perfectly able to perform in your role as a expert in orthopedics. So imagine somebody who is a radio announcer or a TV anchor or somebody who is going to sing a song or play something. If he plays it wrongly, then you're going to say he is not a professional. It is irrelevant under how much stress he is, how much trouble he had getting to the place where he is going to perform and all that. So when you're able to do your work consistently and constantly without letting anything around you affect you, that is professionalism. And unfortunately, I don't think that we explain this or train our people to understand and internalize this idea of professionalism. I am sure that, and I see that most orthopedic surgeons are professional, and even if they begin with not being so. After some time, they understand the importance. But we don't formally introduce them to the concept and teach them. The other thing is like interpersonal and communication skills. We generally expect that our students, when they see their seniors and their teachers, and they will imbibe these qualities from them. They will see that somebody who is good at it, and they'll see somebody who is not so good at it, and they will decide for themselves that, okay, this I think is a good thing, and this is what I should try to imbibe. However, it may happen that some of our teachers may be bad tempered, may not be having the best ways of multilingual talk, for example, or whatever it is. So we also need to stress on this a little bit more in our teaching. Then the next thing is that we are supposed to be good at system-based practice. That means, we may have in our training not been exposed to some aspects of what we understand as system, like patient recording, patient registration, uh, patient records, uh, coming to conclusions in a systematic manner, recording all your findings systematically, and communicating to the patient in whatever way, and then keeping this in a way that next time when the patient comes, we have a system. And many times when we go from a institution into a private setup, those systems do not exist, or we may have to ourselves develop those systems. And this is a very important aspect which unfortunately most people have to deal with in a very erratic, and they don't have help. They don't have resources. Sometimes it is the beginning of practice, and they do not have the funds to invest in very good system infrastructure. So this is another aspect which I thought we should put down. And of course, lastly, continuous education. I mean, you may have passed an exam, but there are so many gaps in your knowledge, which only going back to sources of information and keeping educating yourself every single day with every single patient is the way forward. Now, therefore, your success will depend on your ability to provide good care. Nobody is going to know how much you know, how well you are able to provide care. Your success will depend on your ability to work with others, with interdisciplinary teams, with a surgeon, with a vascular surgeon, with so many others, and how well you can create the team and keep the team and get the best as a member as well as sometimes leader of that team. Your success will depend on your ability to employ evidence-based practice or best practices in every patient. So you may or may not have uh, the best practice at your disposal because you may not have the skill or you may not have the infrastructure. In which case, you should be, sincere enough or honest enough to make sure that the patient is given the option of the best practice that the best solution that is available at some other place. So this is what I mean by ability to employ evidence-based principles. And lastly, you will be judged by how well you can apply quality improvement in the way you function, not only as an individual, not only as a surgeon, but also a member of a team. And that will come if you have the idea that every day I must improve, every day I must motivate whoever is working with me to improve. And over a period of time, I will be able to look back and say, okay, there is improvement, but what more can we do? So most of the people who are successful are constantly looking at themselves, so to speak, and reflecting on how they can improve themselves and improve the team that they work in. And lastly, and this is, I think, very, very important, but I think Ashok will be able to tell more about it, is that you must be good at you must have the ability to utilize informatics, utilize knowledge, because knowledge now is in oversupply. There is such a huge amount of knowledge out there, and you should know how to channelize, how to seek, and how to utilize knowledge, uh, disseminating mechanisms effectively. Now, somebody might say that all this is fine, but what would you consider as a good orthopedic practitioner? And here we have to look at some other things which we have not thought of or talked about so far. One is, and this is a consistent finding that I have talked with any orthopedic surgeon anywhere in the world, the most important quality that is needed is to be responsible. And being responsible is the key. Without being responsible, you cannot be good. You have to be responsible, and you have to be consistently and predictably and reliably responsible. You must have pride in yourself. You must have pride in your ability, but you must have an equal amount of humility with which you carry yourself and you project yourself to people around you and especially to your patient. You must be conscious and be able to articulate your own limitations without feeling any sense of inferiority. You must be interested in people, Many orthopedic surgeons or specialists sometimes find it difficult to inculcate this quality because many of us, are born with very good societal skills. We are naturally friendly. We love talking to people. Even if there is somebody whom we don't know or somebody who is from a different social strata, we are curious enough to be able to interact and communicate and connect with them. But there are many others, like I myself am an example that I'm a very reserved person. It is not easy for me to demonstrate my interest in people. I may be interested as much as anybody else, but I'm afraid because of my own personality to put that interest into practice. I'm sure this problem may exist with others, but as a doctor, you are expected to be interested. So whether you have a personality that is conducive to being interested or not, you better improve and constantly try to improve yourself in this area. This is something that, and there's another thing that I find little different, is that as a doctor, I have noticed that most of the doctors, because through the process of long training and long years of learning their craft, they have very little time for other interests and they become very, very monodirectional. And this is something that makes a big difference to how you deal with life and how well you're able to cope. So you must have and you should have interests other than medicine itself. Of course, you must have a positive attitude. It's not easy to describe or define how that is to be learned or how that is to be acquired. But it is something that you need to have. People who have positive attitudes are usually much more confident and much more able to behave in a consistently friendly manner with everybody around them. So I myself don't know how effectively somebody can acquire this attitude, but it is a very, very, very big advantage if you have that attitude in yourself. And the last thing that I want to talk about is that everybody who is in the medical field and who is dealing with patients and other human beings must have a very high emotional intelligence. And sometimes people don't know, or people find it difficult to understand the meaning of what it is to be emotionally intelligent. To be emotionally intelligent requires you to have a good awareness of your own competencies, your own competencies at a personal level and as a social creature. You must be aware of yourself, what you are, and what is the way you perceive the society around you. You should be able to manage yourself and you should be able to manage your relationships effectively and successfully. So, this is something that can be described with various examples. Um, I'm sure that we will find Ashok useful in trying to understand this a little more.
So,
Now, there is, yeah.
So very important point you made here is it is not about an individual's growth. It is about growth in inclusivity. That you should focus on growing as a team.
Yes.
That will give you a more job satisfaction or mental satisfaction at your workplace. I think so. And when we are talking about work-life balance in this recent era, there is a lot of talks and lot of theories of well-being, physical
Yeah.
and mental well-being or wellness living.
Yeah.
So what is your take? Is it your take on this, and how we can apply that in our practices or in our personal and professional lives?
Yeah. This is now become a very important aspect that is now being uh, propagated in the society, that it is very important that you understand what are the elements of well-being, what are the elements of being in control of your life, what are the elements of having a well-balanced life and a flexibility and ability to deal with the problems and the challenges that will occur consistently and constantly in your life. And this has been very nicely put forward in this theory, which has five uh, main components. The first component, which is denoted as P, is called positive emotions. So it is uh, important that we should experience uh, and become uh, opt for uh, positive experiences and savor and enjoy the moment uh, as your life progresses, because your life will have positive moments. And if you keep them with you, it will be easier for you to deal with the moments that are less positive. The second is engagement, which means that, if you are completely absorbed and engaged in what you're doing, like we are now, we're talking about something and we are focusing and we are engaged. and we are absorbed. And that is the way in which we will automatically start feeling good about ourselves, and we will experience a sense of well-being. So whatever you do in your life during your working day, you have the choice of either being interested, being absorbed, and totally focused on what you're doing. Now, if you're able to do that as often as possible and as consistently, the more you will experience um, happiness or positive emotion. The third is the application of the same positivity to your relationships. So R refers to relationships. So we are all social creatures. We rely on our connections with others, and having deep, meaningful relationships with others is vital to our well-being. We often do not realize that our relationships with the people around us define how happy and satisfied we will be. If we are short-tempered with the people who are closest to us, if we are insensitive to the people who are important to us, it will bounce back on us and contribute to our negativity. So it is not enough to be nice to only your patients. It is not enough to be only nice to the people who you think are important. It is important to be nice to the people who work for you. It is important to be nice to the people who are members of your family, in spite of the fact that they may not in any way be contributing to what you're doing. So the next and the fourth thing is M, which means meaning. Um, you see, whatever you are doing, you may or may not be happy, but if you seek a sense of meaning in what you're doing, and if you believe that whatever you're doing is worthwhile, then it will be much easier for you to not be unhappy or dissatisfied with what you're doing. So, as a doctor, you might feel, okay, why am I doing this? Am I seeing this patient because I'm going to make a little bit of money? Or am I seeing this patient because I've trained as an orthopedic surgeon and there's nothing else I can do? Or am I doing this because I think it, it is important? I remember a small story about this, about a stonemason, who was working on a temple that was being built, and he was doing his work, and when some other person came, he saw that this guy was really enjoying what he was doing, and he was happy. So he asked him that, why are you so happy? You're just building a wall. You're just taking a stone and putting it on another stone and putting something in between, and then doing. I mean, what's so great about what you're doing? So the answer that he gave is very important. He said, for you, it is only this. For me, every time I put a brick or I put a stone, I can see the temple that will ultimately be there in this place one day. And I see myself as a part of the process which created something of beauty. So that is what I mean by the sense of meaning. For professionals like us, it is sometimes difficult to conceptualize and give meaning to what we are doing. But this is an important factor on well-being. And lastly, it is about accomplishment and achievement. We all thrive when we succeed at something. We all feel good when we have achieved something. We've got an award, we've got a certificate, we've got something that kind of acknowledges whatever we have done, or it is a kind of reward for what we have done. But it is also important for us to continue doing what we do and look at these accomplishments and achievements as something that may or may not necessarily happen all the time. If continuously in our life we are constantly looking at acknowledgement, at somebody who keeps telling us how great we are, it is a very negative way of feeling good. So this theory, PERMA or PERMA, is a very important uh, framework or benchmark of how each individual should look at how he can consistently be uh, perceived and perceive himself as being in a state of well-being.
Yes.
I must also mention 4 or 5 things that have consistently been mentioned by society about doctors, which they don't like. For example, a large number of doctors are perceived by society as stubborn. So we have to ask ourselves um, how we can avoid being perceived as stubborn. They are perceived as inhumane, you know. And I personally know that I have often felt that way. I mean, I don't feel, because I'm dealing with human beings who are sick and who are seriously injured, I I have trained myself to keep my emotions out of it. So sometimes this becomes so obvious to others that they resent it. They resent that the doctor is not looking concerned, or is not
Right.
looking,
Right.
afraid, or like that. Um, Doctors are perceived as inconsiderate because we are focused on the patient and what needs to be done. And sometimes we forget that the person we're talking to may have come running from a distance, and we don't tell him, sit down, have a glass of water, and then we'll talk. We are so focused on what we are doing that we are often inconsiderate of the people around. And especially people who want to interact and get them to be on our side rather than uh, on some other side. People don't like us uh, because we try to behave like God. Okay, don't worry. I'm going to, when I treat you, it's going to be okay. In some patients, it works. In some patients, it works, but many times it may not work, and it may be. So these are the few things that I have found to be uh, negative perceptions of doctors. There will be many others, but these are
Right.
the important ones.
Right. So excellent small pointers on the do's and don'ts for a good social and personal well-beings. Right now, you gave us. So now, when you speak about well-being so much, this is the modern aspects and the pointers which you gave us. Uh, so now, when you speak about well-beings, what are the present-day problems, work-related problems for an orthopedic or any physician for that matter? You wish.
Yeah, life as we progress as a race, as human beings progress in every sense of the term, the problems that we face increase, and the problems that we face become probably little more daunting than what they were for the generations before us. Now, for example, I am noticing that uh, the incomes of doctors are decreasing because there is more competition. There are more doctors who are treating the same number of patients. So, the competition, one sees a definite effect on the income of doctors. Doctors of today have a huge problem of dealing with the so-called kickback culture, which may be a legitimate part of many other professions and businesses, but which is definitely not um, liked by society if it is seen or evidenced by them in the medical profession. Unfortunately, I don't know why or how, but society is now not having the same social respect or the same social, admiration for doctors which it once had. Doctors were very, very highly respected, but now, as we have more doctors, as we have a more complex society, the stature of doctors is now becoming less than what it was before. Another problem is that as patients and society as large learn more about health and disease through what I would call social media or sources of information, that knowledge, unfortunately, confuses them, and that leads to them making their own conclusions about their interactions with doctors. And quite often, it is leads to a decreasing faith in doctors. People tend to think that doctors are not giving us enough information. Doctors are giving us sometimes information that is convenient for them. Now, many of these conclusions may be totally false and totally unwarranted. But the fact is that you cannot take out the availability of information and health-related information being, bombarded on the population as a whole through a large number of information sources, many of them who have vested interests of their own. Unfortunately, it's the poor doctor who gets blamed for whatever is uh, happening. And to this is added the current trend of window shopping and going to multiple doctors, um, or every patient having more than one doctor to advise him, which leads to further confusion simply because they cannot process the information and they end up drawing the wrong conclusions. And you can't get away from the fact that doctors are being sued more often now. Doctors are being held accountable. Doctors are being accused of deficient service. And two laws, the Consumer Protection Act and the Clinical Establishment Act, have become very, very potent tool in the hands of society at large, with which to trouble the medical profession, I would say. I'm sure that there may be some legitimate grouses or problems that may occur in patients sometimes. But by and large, the number of litigations that one sees without adequate, uh, evidence is very large. And uh, that leads one to believe that this is the price we pay for the current state of social interactions that we live in. So yes, doctors of today do have a lot of problems, but that doesn't take away from what we talked before, that doctors still have to deliver as doctors. They still have to be good at what they do. They still have to keep their emotional balance and intelligence. And they still have to train and strive to be in a state of well-being if they are to help not only others but help themselves. Yeah.
Absolutely, sir. Absolutely, totally agree with you. So, and like I mentioned initially at the start of our talk, that we in the current world, the doctors are living and practicing in a very hostile environment, and some things are under control and some things are not. So, our well-being, our personal well-being, is definitely under our control. So, coming to the control of our personal well-being, and the main theme of our talk today, the work-life balance. What is this work life balance? How would you like to define it to start with it, sir?
Yeah, see, I think that, life, if you're looking at life in a very broader sense and not talking about life in terms of you're being an orthopedic surgeon, you see, each one of us will be benefited if we nurture these things. All of us have these things as children. We have been born with them. But as we grow and as we acquire knowledge, we tend to forget these aspects, which are the very essence of a good life. And for example, keep your mind open. You know, don't have the feeling that I know everything or there is nothing that more I need to know. Be observant. You will see that children are all the time very curious. They want to see what's happening. They're observant and they are always having an open mind. They're willing to learn more things. And anything and everything that you see around you could be interesting if you choose to uh, have that attitude. That's what children do. Children always look at everything around them. A poor child doesn't need a very expensive toy. He will create a toy out of anything that is around. You know, that comes from that ability of that human being to look at what is around him and perceive it as interesting. And beauty is everywhere. Beauty, as they say, lies in the eyes of the beholder. If you choose to, uh, mm, I remember a story. I don't know how appropriate it is, but you know this famous love story of Laila and Majnu. Okay. Now, Laila and Majnu was very, very uh, deeply in love with. So he's one day his friend asked him that why what is it that you love this Laila so much? I just see some girl. What is it that makes you so deeply in love with her? And Majnu answered, to see the beauty
Sir, sir, your voice is
of
cracking.
Laila, you need to have the eyes of Majnu.
Sound on your end is cracking.
Is it better now?
Yes, sir.
Is
Can
it
you
better now?
a little better? But when you are speaking continuously, I think it is cracking. So
Okay.
you were clearly audible till the friend asks Majnu.
Yeah. So the friend asked Majnu, what is it that you find so beautiful about Laila? So Majnu answers, to see the beauty of Laila, you need to have the eyes of Majnu.
Absolutely.
So
Right.
लैला लैला की खूबसूरती देखने के लिए आपको मजनू की आंखें चाहिए.
Right.
So that is what I mean by beauty. Beauty lies in the eyes of the beholder. And see, most of us, we go through very difficult times in our lives. We sometimes are stressed, we are sometimes unhappy, we are sad. But even in the most adverse conditions, there is always something that may be enjoyable, that may be able to mitigate some of your things, some of your negative emotions. So, can you hear me?
Yes, sir.
Yeah. So, what we need really as human beings is we need an ability to compete in this world, because there's no running away from it. We are competing with somebody and we are competing to be successful. But at the same time, we need to be the uh, catalyst in social harmony. We need to be the on the forefront of keeping things around us in harmony. We must be conscious of the ecology around us and strive to maintain its balance. We must not only cherish our own dignity, but also respect and celebrate the dignity of everyone around us. And we must strive to maintain as much quality as we can in our personal life. It is something that doesn't come naturally. It may not be easy to inculcate and develop. But the more we see quality in our own lives, the more we will become valuable to the people around us. And also, we will be admired more. And to the practitioners of orthopedics, I would like to say that please, please choose to lead an interesting life. Choose to be able to look at life beyond your own speciality and your own profession. Because if you do that, you will be having a much better uh, interaction and relationship with your family. And, conversely, or funnily enough, you will actually end up becoming more effective in your contribution to orthopedics if you have the ability to not give up on the other aspects of your life. And if you yourself are an interesting person, then you will be a much better example for your residents than if you are just someone who is perceived as a automation or somebody who is behaving 24/7 as who doesn't give up his role as being a orthopedic. So I think these are some of the issues that I think are important when we look at life in general.
Right. Absolutely, sir. So, like sir also said that we are living in a very hostile environment, and these things which we can control, which are under our control, of being socially and mentally, personally well-being, the things. So I think it is more about the awareness and mindfulness, doing everything under when being very mindful about what you are doing, right? From treating the patients, from having your personal, maintaining your personal relationships. And it is high time, like there's a famous saying going around these days, that you have two lives. And the second one begins when you realize that you have only one life. So I think
Very,
it is
very true.
to realize this and work on her well-beings. And I absolutely feel that this was not only about orthopedics, but any practitioner would gain some points from our talk today. Ashok Sham sir, any comments, sir? So you are on mute, sir.
No, I said I have quite a bit to comment on. First of all, so there are a few things. Just in the last 40 minutes, we had focused on orthopedic. We had divided work and we had divided life, and then we had tried to balance it out.
Yeah.
I think it's for me, work-life balance is very, very subjective thing. It is very, very individualized and very customized for each and every one of us. What we have mentioned over a period of last 40 minutes are the various factors that is the various different kinds of spices that you can add, subtract, and gauge according to your own personal needs. Okay, so doing this, I mean, adding all these things will not make it a work-life balance, but you have to be very subjective about it. And there lies the problem.
Right.
Actually, there
Yeah,
lies the problem
yeah,
because many of us are unable to face our own selves and to be true to what we actually believe and feel. It's very
okay.
difficult to do that. I mean, sir has mentioned about the emotional intelligence and emotional quotient.
Right.
Most of us just realize those as words, not actually the real meaning of it. I mean, we realize work-life balance as a theoretical concept that
Right.
we should have work and then we should have life and then we should have family. But
Yeah,
the subjectivity and the awareness of it is completely lacking at a lot of stages. It comes in bits and pieces. For example, you attend a conference and you are interested in research for a week. You hear a work-life balance talk by somebody good and you are interested in work-life balance for a week. But then after the week, what happens? Why do you lose it? See, our life should be always be in state of balance. I mean, that's the natural state of things. Who is unbalancing it? I think it is, we have to realize that it's ourselves who unbalance a lot of things. And
Yes.
then we fail to realize it and fail to accept it and want to go through I mean, we do it for various reasons. Probably one of the largest reasons is peer pressure.
Right.
And looking at the world, how it is. I mean, there are a lot of reasons. But we fail to realize that work-life balance is a natural state of affairs. We are not in balance. It is something we have to realize, and we have to
and
realize based on the factors that sir has mentioned. Maybe there are additional factors, but once we realize them, we can easily balance them out. Yes, sir. Go ahead.
yeah, there's just I want to add a little bit to what I said, which actually may help to give some guidelines to what you just talked about. So, according to me, there are 4 things that we need to think about when we have to balance our life. One is happiness. The second is money. The third is altruism. And the fourth is achievements.
I
So,
think, I think, I think. Uh, I mean, there are a lot of people will say there are a lot of scales. Like in research, we have outcome measures,
yes.
things that we measure. I think the only measure of work-life balance is the happiness that you feel.
Yeah,
There's
but
nothing else. I
but
mean,
but but
other things.
almost all of us, for example, uh, uh, consider money as an important criterion of success, and how much money one makes is important to everybody. Uh, so we
So the
must
thing is
we
that
must no we must understand that, for example, doctors are generally well paid and they earn good money.
Yeah, I mean,
So,
see, the
so
money is money. The money issue, I always take it as needs to be enough. Now we have to define what enough is.
no, when I talk to doctors, when I talk to others, doctors say, you know what, we spend almost half our life without any money. We start earning later than almost all other professionals. And we are constantly being berated for earning more money than what we deserve. So they are a little unhappy about doctors being perceived
Like
as,
like I said, it is very subjective. Your
yeah, but
happiness is absolutely subjective. If you're going to talk about things like, I mean, we have met millionaires who are unhappy
yeah, but
and sad. They have a lot of
yeah,
money and they have a lot of perspective. They have made, in others' eyes, they are successful, but they are unhappy.
yeah. I just want to add a little bit, which is not nothing to discuss, but I want to just mention two or three facts. One is that the earnings of doctors will peak between 40 to 49 years of age. That means it is unlikely that after a certain age you will start making more and more money, like maybe a businessman or a corporate or somebody it will happen. So because
Like,
their
like, I,
profession,
like I again said,
yeah.
it's subjective. Money has to be enough, and enough has to be defined by you.
No, but also we have to understand, see, if we are not to be affected by our perception of success relating to money, we have to understand that at some point in our lives, we will stop making more money.
No,
We will peak. We will,
I have an issue with equating success with money.
well, if we have
I
to,
mean,
since
I
you
can
may,
be successful and the money can flow in, and I can be unsuccessful and still I'll have money.
yeah,
So,
but
so if I
see,
have success, that is good enough, and money will come with the success. I
yeah,
mean,
but
I want us to be successful. I don't want us to be unsuccessful at all.
I'm sorry, but there are two additional factors which are added to this. One is we always compare with others. So
Exactly.
when we
That
look
is
at,
where the subjectivity of our happiness lies. I mean, we are gauging ourselves in lies of, and it is unconscious. It is built up in the society and the culture. A lot of us don't do it intentionally. We actually realize that it is not correct behavior, and we know that it is not correct behavior, but we go on doing it, and that causes us misery at a lot of levels.
agree,
Irrespective of
so
whether we are successful or whether we have money, we'll always find somebody more successful than us and having more money than us,
yeah, so
isn't
I
it?
think you have spelled it out very nicely how we should perceive and define our relationship with money. I'm going to add one more thing, and that is altruism. Because doctors are supposed to, and the society wants us to uh, give our skills for free, for work for
Again,
good causes.
I
So
think it is very subjective. And altruism is not only doctors, a lot of non-doctors and a lot of people do altruism because it makes them happy, or they feel or they believe in the concept of what they're doing, and I mean, they believe in it and they want to do it, and it makes them happy. That's what it is. I mean, nobody is supposed to do. I mean, I think we should be coming out. We as doctors should be coming out of this mental framework that in society we are supposed to do altruism. It is our choice,
any
and we
any
do it.
any person should be willing to be altruistic.
Yeah, it is by choice, and it, and any good human being will do it. But you cannot force it on us, and you cannot force ourselves into us, isn't it? It has to be voluntary. It has to be coming in from I want to do it. It cannot be
so
that society wants to do me. It is
so in other words, what you're saying is, if a doctor wants to be altruistic, he is welcome to do so.
yes.
But if he chooses not to be altruistic, It is just as
Yes,
good.
just as good. Of course, it is just as good. So he's already doing a lot of things for his own patients, which do
No, no,
not
I
count.
think no, no. I think that I need to explain a little bit.
No, even
Altruism.
I mean, we are not providing a service like Amazon is providing to his buyers. We are into a completely different industry of life, death, pain, suffering, and a lot of other things. Even comforting our
No,
patients is a
no, sir.
great different. Yeah,
Let
yeah.
me explain a little bit. I think that we need to understand one thing, that as doctors, we are constantly required to help people who are sick. Okay. And because people who come to us are vulnerable, we are forced to make altruistic choices. That means if a patient says, I don't have money, a lawyer, no, please hear me out. A lawyer
Mhm.
can say that, okay, my fees are XXX, and if you can't pay my fees, I will not take your case. Now, because there is no immediate personal, discomfort or this thing, a lawyer can get away with choosing to be altruistic or not. But a doctor, most of the times, if he chooses to ignore the discomfort and the pain of his patient and insist on being paid his fees without which he'll not treat him, it is not perceived in the same way as it would be for other professionals. We have to accept that because we are
No,
dealing with
that's what.
people who are.
In fact, you are making the same point that I am saying, that we are offering much more than
No,
money
so
and time to our
no,
patients.
but
We are
so that
offering
means
much,
you
much
are
more.
no. So that means what you are saying is doctors quite often and very often do not have a choice. They have to be kind to people. They have to be altruistic in a small way or in a little
Okay,
way.
so kindness and altruism are two different things.
No, but when I say altruism, it means you offer your skill for free or for a discounted price. Let me
So many a
define
times we
altruism.
might be forced in an emergency situation,
Yes.
but on a
No,
practical basis, we may not be forced. In an emergency
agreed. No,
situation,
no. I
no, no.
agreed that
So hear
if
me
you,
out. Even if I
yeah,
am not a doctor, I
yeah.
see a roadside accident. As a human being, I'm forced and inclined. It's not force. I'm inclined to help that person. It's a helping another human being in pain and suffering. You don't need to be a doctor to do that. You can do that without being a doctor. Being a doctor makes you more efficient in doing it. But of course, you can. Everybody does it.
No, I am
That
not
kind of
comparing
altruism
doctors with,
and thing
no, no. I'm
is
not
different.
comparing doctors with laymen. I'm comparing them with other professions like
Yeah. No,
engineers,
no. I mean, even
lawyers,
if a lawyer
architects.
sees a roadside accident, he's
No,
gonna
no.
have.
I'm saying, will a lawyer give his services free as a lawyer? I'm not talking of as a human being.
In
Why are
emergency
we going to getting into
situations, all the emergency situations, I think it is valid.
what emergency situation do you see for a lawyer
No, no. In any emergency
as a
situation, not
professional?
I'm saying
No,
in
no.
lawyer.
See,
Why should we compare with lawyers? It's not.
no, because no. I think that we digress. We were talking of what we do as professionals, not what we do as human beings. These
No,
are two
what we are
different
saying
things.
is actually you're making the same point that we do altruism whenever it is required.
No,
So
but we are required to
personal
do it
ones,
more often than anybody else.
that is acceptable. That's great. In
Yeah,
fact,
that's what.
good for our profession. I mean, it's good on our part.
So all right,
So what's wrong with it?
let's agree to the fact that doctors are uh, more often asked to or required to make choices which are in the direction of being altruistic. And of course,
But
as you
more
rightly
often
said,
than that, more often than not, we are in a position to refuse it or make a choice. More often
sure,
than not.
sure,
Yeah.
sure.
But
Well,
we choose
that
it. But see, a lot of us choose this is I mean, should I say it on air or not? But it is more of a make pretend altruism. When we start doing
okay.
those camps and start selling those BMD machines and stuff like it is make pretend altruism that I mean that's where I said we have to be aware of what we are doing. It is so subjective. We don't accept that our work life is not balanced because we do stuff which are imbalanced. We have to have that self awareness to be realizing that what you're doing. Unless you realize that what you're doing is ethical, what you're doing is right, what you're doing is correct, it is not going to make you happy. And if you're not happy, then there is no work-life balance. That's the only scale for me, your happiness. If you're happy enough, your scale is balanced. If not, then
I
find out why it is. And if it is modifiable, modify it. If you cannot, then accept the imbalance work-life thing. You cannot balance it.
somebody once told me that real happiness comes from helping others. And as doctors, I have always believed that I have personally felt happiest when I was helpful and I was altruistic. So it is, I agree with you that it may not be the same for everybody. And I perfectly accept the fact that people can and should choose what they want to do for happy. Because everyone's idea of what constitutes personal happiness may be completely different. I have to
Exactly.
concede that.
And they should do. Otherwise, they have to. So a lot of problem is not because of work-life imbalance, because people cannot accept the work-life imbalance. Go ahead and accept it. Whatever imbalances are there, if they are not so huge as to be totally tipping into one direction, you can accept a lot of imbalance and make it part of your life. Nobody is in perfect balance. I am yet to find somebody who is in perfect work-life balance, although a lot of people claim. But there are always the balance is towards work. Most of these people who claim to be work-life balance are successful people whose balance is almost 80% tipped towards work, and that is what they call work-life balance. So
So,
again,
yeah,
that is
but I mean,
subjective.
uh,
It's
uh,
subjective. It is
Yeah,
yeah,
subjective.
but when we say subjective, it could mean that if you are immersed and engrossed in your work, uh, whether it's 80% or 8%, you have to understand that 80% work working people will be uh, more satisfied than people who are working 8%. So it all depends. I mean, I don't know. I think there is a direct ratio between how engrossed you are in what you are doing and how happy you are. But I concede that it may not be so in every individual. It's quite possible.
Yes.
I
so
just
Yeah,
want to.
Tarang, go ahead.
yeah, so in a nutshell, we would like to, I would like to conceive what we spoke and have a very nice, healthy discussion. It's like Sir gave us pointers on being physical, mental, and social well-being. In short, Sir gave us pointers to help us be happy. And happiness is, like Ashok Sham Sir said, happiness is very subjective. When Sir gave us the pointers of happiness, money, and altruism, that very rightly Ashok Sham Sir said that it is very subjective on how much money and on whether to be altruistic or not, how much altruism is good altruism. And I would also agree on what Borate said, that uh, we as doctors are expected to be more altruistic and as compared to other professions. But then again, like you said, it is subjective whether if a doctor is not altruistic, it is as good as a doctor being altruistic. And also a very valid point made by Ashok Sansal, that forced altruism will also not work. It will not make oneself happy if it is forced altruism. So this was a good talk on how to be happy in your workplace. And happiness comes from what the subject, it is very subjective, how much money you, and a very interesting point, that work, rather than going for a work life balance and just focusing on work life balance, accept the work life imbalance, like Ashok Sham Sir said. Because a lot of new residents or doctors who do not have a background of do not have a medical background, their parents or their family members, none of them are doctors, they see their bosses and professors as their idols, and they try to emulate what they are trying to do. So again, there it causes a lot of problems. So I think there the young surgeon or the physician should draw a line and decide what is happiness for him over there.
Absolutely.
So it was
Wonderful.
a wonderful talk and very healthy, nice talks we had tonight. I think we should wind up now.
Thank you.
Yeah, Taran.
We
Thanks.
Yeah,
agreed.
sure.
I
Thanks.
think we agreed on some points and agreed to disagree on some other points, and we conclude tonight.
Yeah, absolutely.
Yeah.
Thank
Sure.
you. Wonderful. It was a wonderful time.